Hi, good afternoon. Today I'll be presenting about therapeutic exercise. And so, what exactly is therapeutic exercise? Therapeutic exercise is a modality that comes from the biomechanical frame of reference, which focuses on the evaluation and intervention of range of motion, strength, and endurance. And its focus is to look and improve physical limitations that are interfering with the client's ability to complete their daily occupations. And so this image here shows an example of therapeutic exercise by using bands. And so continuing on to what is therapeutic exercise. Therapeutic exercise is designed to restore function, flexibility, and improving duration, strength, and endurance through physical activities and movements. And there are 8 types of therapeutic exercise that I will be covering in the next few slides. But for now, we're going to discuss the goals dealing with therapeutic exercise. And so, the following are the goals of therapeutic exercise. The first goal is to increase muscle strength. The second goal is to maintain and improve joint range in terms of flexibility and motion. The third goal, to improve coordination of the body. Fourth, to improve muscle duration. 5, to improve physical conditioning and cardiovascular fitness. And so now the goals are going to tie into the next couple slides that are going to cover the 8 different types of therapeutic exercise. And so now we'll start off with the first one. So the first type of therapeutic exercise is active assisted, and the general goal that it covers is to increase muscle strength. And so a description of an active assisted, it refers to exercise being mostly completed by the client themselves. However, they are assisted to complete the exercise by the practitioner or therapeutic device. The assistance is needed due to changes in muscle tone, weakness, or pain. And an example of active assisted would be someone sitting down and lifting up their leg as high as possible in the manner that they can. And then, so this image is an example of active assisted. Here we have the practitioner helping out the patient stretch out their arm as far as they can. Okay. The next type of therapeutic exercise is resistive. The general goal that it covers as well is increase muscle strength, and it refers to the physical activity done by the client in which they move their body part through a certain range of motion against resistance that is added by therapeutic equipment, weights, or manually. The resistance is increased as the practitioner observes an increase in the client's strength. And so examples of that are deadlift, push-ups, sit-ups, bench press, bicep curls, and even free weights. And in this image we have a practitioner helping out a client to lift weights, and so that describes more endurance. So now moving on to the next one is active range of motion, which falls under the same general goal of increasing muscle strength. And so active range of motion refers to the client's ability to move a body part without any assistance from the practitioner or any medical devices. Muscle contraction is good, resulting in joint movement that allows client to conduct activities with no help. Example would be someone lifting up their arms above their head, up and down shoulder movement, head tilting, and then all of these without obviously any assistance. And in this image, we see the guy lifting his leg up, and the little arrow shows that he moved it up by himself while the practitioner was just watching. Okay, so the next one is passive range of motion, and this one covers a different general goal, which is maintaining and improving joint range of motion and flexibility. And this is an activities that are completed with the help of an outside force, such as a practitioner, since the client is not able to move a certain body part to help move it. So this is where the joint can be found. Movement can be found for the maximum capacity. And examples of this are continuous passive motion device, hip and knee bends done by practitioner. And so in this one, we have an example of the knee bends. Okay. So the next one is coordination training. And the general goal that it covers is improve coordination of the body. And then coordination training refers to physical activities involving repetitive exercises that need smooth, controlled movement patterns. This allows for the assessment of the body's ability to conduct movements from responses from the brain. And so examples of this are stacking blocks, picking up marbles, skipping, ball dribbling, and then in the picture here we see a woman doing sort of like a balloon toss, and that is an example of coordination training. So the next one is low load, high repetition program. The general goal that it covers is to improve muscle endurance. And then so the low load, high repetitive program is a physical activity that requires the OT practitioner to find the client's maximum capacity for strengthening, followed by a reduction in the maximum resistance load, preceding an increase in repetitiveness. And an example of this would be weightlifting, which is how we see in the picture here. Okay, so the following one is, the next type is sustained rhythmic aerobic. And the general goal that it improves is to improve physical conditioning and cardiovascular fitness. And so it is a physical activity that uses large muscle groups in a repetitive and rhythmic way to increase heart rate and evaluate oxygen levels in the body. And so examples of this include swimming, jogging, walking, running, and cycling. And so in this image here, we see the example of people jogging, which is perfect for the sustained rhythmic aerobic exercises. And so, lastly, when is it more effective? Therapeutic exercise is used to help reduce pain, increase flexibility, improve balance, and improve function of movements needed to complete daily occupations. And so, it is most effective when used to treat people that have osteoarthritis or any sort of skeletal and muscular issues, or they are recovering from a stroke, or have increasing joint pain. And so it is beneficial by providing clients after treatment with better wellness, better posture, improved mood, relaxation, and provides an overall better management of pain. And so these are my sources page. And thank you for listening to this presentation.